in adult onset diabetes is the incidence in our country is increasing phenomenally. The just released ICMR-INDIAB guidelines, where survey was carried out throughout the country in all the states, it found that the incidence of type 2 diabetes in our country is currently more than 10 crores. So it is covering almost 11% of the Indian population, and this is exploding at a very faster rate. It was not expected to reach this fast, and prior to diabetes we have a pre-diabetes status where the glucose homeostasis is not normal, the glucose metabolism is not normal, and that incidence is, as was mentioned, was 15% of the Indian population has pre-diabetes. So together, if we take diabetes and pre-diabetes, 27% of our population is having this phenomenon. And why we are, why we would like to emphasize on this is that prevention is the need of the hour, because diabetes is not a just disease of a glucose disturbance. There is complications of diabetes. So these complications, one of which we are discussing today is product for which is diabetic foot ulcer. So diabetes classically affects the smaller blood vessels, which is called as microvascular disease, and it affects the larger blood vessels with complications. So these complications are, retinopathy, that they affects the vision. So it's a preventable cause of blindness. Then you have nephropathy, kidneys getting involved, and then neuropathy. So neuropathy is very, very common complications, and neuropathy is one of the reasons for diabetic foot disease. The other part is, macrovascular disease. When we talk about, you have the coronary artery disease. So a type 2 diabetes patient is much more prone to a heart disease, what we call it. He is also prone to cerebrovascular disease, meaning when the brain blood vessels are affected, it results into stroke or loss of one side is gone. So there is a paralysis of one part of the body. And then the third circulation is the peripheral circulation, which is peripheral vascular disease. So diabetic foot, there is a combination of peripheral arterial disease and also neuropathy. So these are the two things together which does things. Along with that, if the diabetes is neglected, then it becomes uncontrolled hyperglycemia. The glucose levels go down. So this when the glucose is uncontrolled, the normal pathway for glucose metabolism, which takes place from glucose to ATP and it is converted into energy, that pathway is actually oversaturated. So glucose to glucose 6-phosphatase does not take place. So it goes with the alternate pathway, and in that pathway the glucose is diverted to sorbitol and fructose, which are harmful chemicals are generated, which technically we call it advanced glycosylation end products. So they will cause all the complications of diabetes. And this particular product is actually a beta blocker, cardioselective beta blocker, but was approved in 1986 for treatment of arrhythmia. Arrhythmia is where the heart beats abnormally faster or things like that. So this product was approved. Intravenous drug was available in all the markets, including India, where it is used to treat arrhythmia and hypertension when the patient undergoes anesthesia and intubation is done. So that's the use of this product. But now it is repurposed for diabetic foot ulcer by doing molecular docking studies by NovaLead, where they showed that it corrects the aldose reductase pathways where the glucose metabolism is directed to at the local level as well. So where it creates blood circulation impairment and all that. So when you prevent this inhibition of aldose reductase pathway, you add in the ulcer healing. So this is very, very important. But it is important to remember that not only the application of this particular gel form at the feet level when the ulcer takes place, it is very important to address the peripheral circulation. So there are products to that, and IPCA has one product which also works there. And diabetes was initially considered just a glucose metabolism problem. It was just considered a metabolic disease. But as the science advances, your understanding also evolves. So then from metabolic disease, then it was found out that diabetes patients are more prone to heart disease. So it's not only metabolic, it is a vascular disease. So from that it came that diabetes is not just metabolic, it's metabolic also, vascular also. then further understanding took place. Now the understanding is that diabetes is also low-grade inflammation. So there is a low-grade inflammation taking place, and that inflammation gives rise to progression of diabetes, complications of diabetes. So this is how the understanding has improved, and so there is a need to address this inflammation as well, which also can be done. So this is a comprehensive management is required. Control of blood sugar is very, very important. And this uncontrolled diabetes is creating all the complications which we are discussing, like diabetic kidney disease, retinopathy, retina involvement, and the peripheral arterial disease, peripheral neuropathy. So all these complications, a comprehensive management of all diabetes is required, along with the, of course, we have to take care of the ulcer, because diabetes are routinely told to inspect their feet regularly. So there is a very lot of preventive advice also should be given while treating this particular disease. I think that's what. Diabetes, treatment is there, insulin and the newer oral anti-diabetic drugs where type 2 diabetes is managed. For type 1 diabetes management, you require insulin, but type 2 diabetes management can be done with oral drugs. And when the oral drugs are not working, then insulin is usually preferred. Inflammation has been recently identified as a factor in type 2 diabetes, but I would like to add that IPCA has done pioneer work in addressing this inflammation in type 2 diabetes. So this low grade inflammation, IPCA has a first drug which is again a repurposed drug. Incidentally, this is because this is a beta blocker which is repurposed for diabetic foot. We already have a repurposed drug which is hydroxychloroquine, which is used in rheumatoid arthritis very, very widely to control the inflammation. The same drug is used in type 2, is been approved in type 2 diabetes to address the inflammation. So the first drug to address inflammation type 2 diabetes has come from IPCA. So this is what I thought I'll add that. All the products which are developed by multinational companies, patent life is over and we market them. That's the conventional model of Indian generic companies. So only difference between Indian market and global market is that we make them with a brand name and we market it. So we are branded generics as compared to just purely generic markets. That's the difference. But very few products come out of an Indian research. So one such product is this diabetic foot ulcer product.
It is a repurposed drug, originally an intravenous injection. It has been converted into a topical gel for diabetic foot ulcer. A product like this has never ever come before from India. So the example of IPCA's earlier success with the inflammation drug is it's an oral drug applied in new indication as an oral drug. Here the drug was intravenous injection converted into a topical gel in a new disease area, thereby enabling the company to get global patents. So NovaLead holds the global patents for this particular drug. This is probably the first of its kind in India's history of 77 years of independence.
Excuse me, sir. You mean
these type of products are required basically where the doctors are practicing. It's not with every retailer. So I think to zone already it's good number of doctors available. So maybe another 10 to 50 days freely available. It's not an issue. There's some of physicians are doing this practice. Some surgeons are doing this. Some of vascular surgeons also. So total in the country there are 2,400 doctors who treat this diabetic foot ulcer. Because we collect this data from the doctor who treat diabetes. When the patient comes with the foot, where they recommend. So we will definitely in the first phase goes to all the doctors to promote this product, and later on we will expand and we have to create the noise how to save food.
So national standards is cleaning the wound twice with saline water, removing the necrotic tissue around the wound if there is any, and then bandaging the wound in a moist environment. This is all that is done as standard of care. More importantly, the doctors prescribe that the blood glucose levels have to be controlled very strictly. Otherwise, the already existing diabetic foot ulcer worsens very, very rapidly. So the idea is control the blood sugar and do this bandaging twice, as just I mentioned.
So, like, how many days this?
This you have to just wound management so that it doesn't get to amputation stage. With the drug Diulcus, the idea is to completely heal the wound so that it doesn't, the question of worsening and leading to amputation does not arise.
So is there